But without further ado, now we know the first action step to reduce risk of heart disease being screenings. Now let's talk about some additional steps that you can take, including fitness. So we're honored to have Chief Kerrigan with us on today, and I'll also be providing some tips for you as well as a certified tactical strength and conditioning facilitator by the NSCA. And so let's get to it. Let's talk about the big 8, Chief Kerrigan.
Sure. I'm going to preface this very briefly by just putting a period at the end of Chief March's comment. As an analogy I use a lot that I really think that especially the chiefs in the room really need to take to heart. We think about in emergency services the amount of money that we put into preventative maintenance programs for our equipment and our apparatus, and why we do that, and how it's proven to save a lot. It's proven to save money. It's proven to extend the life of the equipment. The repairs that do have to happen are much less costly normally. So there's a proven approach to this that we've done for years in emergency services, police, fire, and otherwise, because of the return on investment that in many ways that happens, right? We need to think about our most important asset, that's the people. We need to think about those folks the same way. It is so much more valuable to our people to provide them with the preventative approach to these medical issues than it is to have to wait until, unfortunately, something bad happens and then have to address it then. So there's reasons why we do this. We've not made that complete connection, I think, from the stuff that we ride on and the things that we carry to the actual person that does the work, right? We need to do that. We need to be much better at that. So just wanted to kind of throw that out there just as a point. But the big 8, so we'll talk about the big 8, because when it comes to fitness, we really believe that it's not about aesthetics and what you look like and that sort of thing, as much as it is about performance and improvement in terms of your ability to do the things that you need to do at a high level and relating it to what we do, right? So the big 8 was a concept that we developed for the book that really hopefully serves to address all the functional areas that we need to pay attention to when we're thinking about our fitness, right? So the first 3, what I would consider the foundational components of the big 8, would be core strength, cardiovascular capacity, and flexibility. And I know that we don't have time to go deeply into any of these, but those are sort of the foundational components, right? We need to address our core, which is our front, sides, and our back. We need to make sure that we're doing that to make sure that the rest of our extremities are going to be able to do the things they need to do without suffering injury. Cardiovascular capacity is huge. We need to be able to perform especially in an anaerobic state for extended periods of time, and also exert that moderate force or that muscular endurance that we need to build as well. And then flexibility, of course, probably, I don't want to put words in anybody else's mouth, but probably one of the most important and least discussed things for all of us, and probably for most of us, our biggest weakness is flexibility, and that ability to operate in a full range of motion and properly take care of our joints and so forth, so that we reduce injury risk and we're able to perform at a higher level. So those would be the three foundational components. And then we tried to simplify the functional strength aspects into very simple push, pull, lift, carry, and drag. And if you think about what we do, especially on the fire ground, well, that's what we do. We push things, pull things, lift, carry, and drag things. So all of this is to say that the things that we do in the gym or at the fire station or at the police station, wherever we go to do our workouts, we should be focusing on improving in these areas and doing it for what we do for a living, for what we do, whether you're volunteer or career, doesn't matter. What do we do? Just like a gymnast trains to be better at what a gymnast does. A football player trains to be better at what a football player does, and those exercises and movements are specific to their performance. We should be doing the same things as firefighters, as police officers, EMS personnel. We should be focusing on better performing in our role as I hate to say the cliche, but a tactical athlete or an industrial athlete, if you will. So this is sort of the concept that we came up with, and then there's many layers to that, as I'm sure Mandy will chime in on.